Welcome to UMCC Medical Consultants. In moments of crisis, when seconds feel like minutes and help seems far away, knowledge becomes your most powerful tool. Today, we will calmly and clearly walk through emergency injections. My goal here is not to create anxiety, but to empower you to act decisively. This conversation is about demystifying a procedure that can seem intimidating, yet is a straightforward, life-saving intervention. We will discuss what these injections are, when they are needed, how you, a bystander, a friend, a family member, can safely administer one. Emergency injections are not part of routine medical care. They are extraordinary measures for extraordinary circumstances. Think of them as a bridge, a vital connection between the onset of a life-threatening event and the arrival of professional medical help. They are specially designed medicines, often housed in easy-to-use devices, that work rapidly to counteract a severe medical crisis. So, what exactly are these emergency injections? In the simplest terms, they are pre-measured doses of powerful, fast-acting medication intended for immediate use during a medical crisis. Unlike pills that must be digested, an injection delivers medicine directly into the muscle or bloodstream, allowing it to get to work almost instantly. This speed is what makes them so critical. In situations like a severe allergic reaction or an opioid overdose, the body is in a state of rapid decline, and there is no time to wait for a medication to slowly take effect. These injections are designed to interrupt that dangerous cascade and stabilize the person. It is crucial to understand that these are not cures. An emergency injection is a temporary fix, a life-saving tool that buys precious time. Its function is to reverse the most dangerous symptoms of an emergency, like a closing airway, respiratory failure, or a dangerous drop in blood sugar, long enough for paramedics and emergency room doctors to take over. This is a fundamental point. Administering an emergency injection is always the first step, and the second, equally important step, is always to call for professional medical help. You are the first responder, but you are not the final one. The medications used in these injections are highly specific to the conditions they treat. You would not use an allergy medication for a diabetic emergency, for instance. That is why it is so important to correctly identify the situation, if possible, and to use only the medication prescribed for that individual and that condition. Many people with known severe medical conditions will carry their own emergency kits. Your role might be to help them administer their own medicine, or, if they are incapacitated, to administer it for them. The packaging itself provides a wealth of information, from the name of the drug to its expiration date. The beauty of modern medical design is that these devices are largely foolproof. Let's talk about 3 of the most common situations where you might need to use an emergency injection. Anaphylaxis, overdose, diabetes. The first is anaphylaxis, a severe whole-body allergic reaction. Trigger, peanuts. Trigger, shellfish. Trigger, insect stings. Trigger, certain medications. Sign, difficulty breathing. Sign, swelling of the face and throat. Sign, hives. Sign, rapid drop in blood pressure. Sign, potential loss of consciousness. For this, use epinephrine, EpiPen. Epinephrine constricts blood vessels to raise blood pressure. Epinephrine relaxes airway muscles to help breathing. Diagram, correct outer thigh injection site for epinephrine autoinjector. The second scenario, opioid overdose. Opioids, prescription painkillers, opioids, heroin, opioids, fentanyl. Overdose sign, unresponsive. Overdose sign, very slow or no breathing. Overdose sign, blue lips and fingernails. Overdose sign, tiny pupils. Life-saving injection, Naloxone, Narcan. Naloxone knocks opioids off brain receptors and can restore breathing immediately. The third scenario, severe hypoglycemia in diabetes. Cause, too much insulin. Cause, not eating enough. Symptom, confusion. Symptom, shakiness. Symptom, seizures. Symptom, loss of consciousness. Emergency injection, glucagon. Glucagon signals the liver to release stored glucose, raising blood sugar quickly. Use when the person can't safely swallow juice or glucose tablets. In each emergency, the injection is a specific antidote. Anaphylaxis, epinephrine opens airways. Overdose, naloxone restarts breathing. Hypoglycemia, glucagon raises blood sugar. Know the signs. If the person has a known condition, they or family may tell you what's happening. Your role: listen, observe, and act quickly with the correct tool. Now, let's walk through the basic steps of giving an injection. The single most important thing you can do is to remain as calm as possible. Your calm demeanor will help keep the person in distress and any other bystanders from panicking. First, assess the scene for safety. Watch for traffic or other hazards. Call for emergency services. 911 in the United States. State your location and the nature of the emergency. Put your phone on speaker so you can communicate with the dispatcher while you assist. Once help is on the way, locate the emergency medication. Look in the person's bag. Check their pockets. Check any medical kit. Read the label quickly. Confirm it's the correct medicine for the situation. Check the expiration date. Do not use expired medicine. Check the viewing window. The liquid should be clear. If it's cloudy or has particles, do not use it. Most emergency injections are one-time use. Follow the device instructions. For an epinephrine auto-injector, remove the blue safety cap. Press the orange tip firmly into the outer thigh. It can be given through clothing. You will hear a click. The injection has started. Hold for the recommended time, usually 3 to 10 seconds. After removal, gently massage the site for about 10 seconds. For a naloxone nasal spray, tilt the head back. Insert the nozzle into one nostril. Press the plunger firmly. For injectable naloxone or glucagon, you may need to mix a powder and a liquid first. The kit will have pictorial step-by-step instructions. Follow them precisely. Common injection site: outer thigh. Common injection site: upper arm. Common injection site: buttocks. After administering, place the used device to the side for paramedics. Never try to reuse it or put the cap back on an auto-injector. Your job is not over once the injection has been given. The period immediately following the administration is just as critical. The most important thing to do is to stay with the person. Do not leave them alone under any circumstances. Their condition can change rapidly. Your presence provides reassurance and vital observation. If the person is unconscious, carefully roll them onto their side into the recovery position. If the person is vomiting, carefully roll them onto their side into the recovery position. This simple maneuver keeps the airway open and helps prevent choking. Continue to monitor breathing and level of consciousness. Note the exact time you administered the injection. Relay that time to the emergency team when they arrive. Some emergency medications can be temporary. Epinephrine, naloxone. The initial life-threatening symptoms may begin to return as the medicine wears off. Check device instructions. Some allow a second dose. Typical wait: 5 to 15 minutes if symptoms persist and help hasn't arrived. When paramedics arrive, clearly and calmly tell them what happened. Describe the symptoms you observed. Describe what medication you administered. Tell them the exact time you gave the injection. Hand over the used injection device. It confirms the medication and dosage. This handover ensures continuity of care and helps the medical team make the best decisions for the patient's ongoing treatment. Your role as the initial responder bridges the gap. Good communication completes that bridge. Thank you for taking the time to learn this invaluable skill with us at UMCC Medical Consultants. Being prepared can turn fear into hope. Review instructions for emergency kits at home or work. If helpful, like, subscribe, and share to support our mission. Your share could help someone else save a life. Stay safe and stay prepared.